go ahead. Yep, because you're...
They watched.
We are preparing Gretchen for her upper blepharoplasty. Thanks for joining us. We're very excited, and I'm going to have Tiffany step out of the way for 1 sec. Great. So anyway, we've been waiting to live stream our blepharoplasty, and today this is the way things are going to work here. We're going to talk, we're going to measure and mark, which is how we start our procedure. We're going to localize. We're going to get Gretchen numbed up. At about 11:45 in 15 minutes, we're going to be joined by Channel 12 with Liz Bonis. It's going to be a little bit of a gap. We might take some questions and answers during that time, and then her live segment usually airs a little after noon. Following her live segment, we're going to show from beginning to end a full upper blepharoplasty with Gretchen here. So we're going to get started, and we are going to show you a little bit about what eyelid surgery is about. So Gretchen, I'm going to drop your head down a little bit. Gretchen has received some Valium, so she's pretty mellow. And so first thing we're going to point out, go ahead and close your eyes if you don't mind, is you can see where her natural eyelid creases are. And if we just, do you have a Q-tip possibly? If we just push up a little bit on her on her eyelid, it's pretty clear for Gretchen, but you can see where the natural crease folds here, right about here. And so we're going to begin placing a little dot in each of these areas. Usually this is about 8 to 10 millimeters from the eyelash margin. So if you can see on my calipers here, hers is at about 9 millimeters. So we'll want to even these up. Her left one's at about 8 millimeters. If we are interrupted at all, it's just Channel 12 who's trying to make sure that we're connected, so we might have to take a little pause. Sorry about that. Okay, so we're going to follow the natural curve of her eyelid here. And so this is her lower marking. So the next thing we're going to do is literally we're just going to pinch, and we're going to measure sort of the amount of extra skin. You can see as I pinch, you can see her eyelashes start to evert a little bit. So we don't want to think we're helping her by removing all of this tissue here. This is her, what we call the infrabrow tissue, or her tissue below her eyebrow. Eyelid skin and an upper blepharoplasty addresses this crepey stuff, this hooding here. So we're going to pinch this literally, and we're going to make a little mark here. When we get out to what we call the lateral canthus, which is where the upper and the lower eyelids connect, we're going to change our orientation a little bit, and we're going to come up a little. Same thing here. There's a little puncta in the lower eyelid here. We're going to come up here. You can see a little crow's feet she has here, so we're going to try to follow that marking. We're going to come back and forth here after we look at the right side. So we're going to come over to the right side here. The two sides are always different. We think that we're symmetric, but of course we're not. Our goal is to create more symmetry after this procedure. In women, we may come out a little bit. The idea is to open up the eye to the rest of the face. So these measurements that we take in men, we might back off a millimeter or two, and in women, we're a little bit more aggressive. We'll come up here and take a little bit more tissue. So Gretchen is on Valium. I mentioned that. There's no IV sedation. There's no general anesthesia. She is being monitored. You might be able to hear that beep in the background. That's her heart rate. And she's got blood pressure monitor on. Okay. We don't want to come too far beyond the orbital rim here. But like I say, in women we come out just a little bit further. So these look pretty good. All right, so the next thing we're going to do here is we're going to go ahead and get her localized, and I'm going to adjust the camera just a little bit. Okay, great. So what we do is we use lidocaine. Lidocaine is a local anesthetic agent, and it contains epinephrine. Epinephrine is responsible for what we call vasoconstriction, and that will help blanch the tissue so that there's minimal bleeding, as you'll see during the procedure. All right, Gretchen, so I'm going to get you numbed up here. You ready? So a little pinch. 1, 2, 3, and a little stick. This is the part that hurts a little, sorry. So we just slowly inject so it doesn't burn too much. Give me 1 second, Leslie. I just want to check one thing here. Okay. All right, and we're going to come to the right side too. Gretchen, another little pinch here. 1, 2, 3. Sorry, and a little stick. Yep. I just try to move my finger around a little bit to distract her. Gretchen, how's that feeling?
It feels fine.
Okay.
Hardly hurts at all.
Okay, so we kind of come back and forth a little bit. She should be mostly numb right in this area, so she won't feel that. And we're just going to progress over her eyelid. We used to do these procedures under general anesthesia or IV sedation, which is really unnecessary.
I did not feel that one at all.
Good. Now you'll feel most of these. Now, as I get more towards the middle, the central part here, it might feel a little bit cold.
I like the wiggling finger.
Yeah. Kind of distracts you a little bit.
Mm-hmm.
You look like you're in a pretty happy place right now, Gretchen. Okay, so a little bit more here, a little back and forth.
Didn't feel that one at all.
Okay, good. Does that feel cold there?
It does.
All right. Little tiny bruise. You can see where that was bleeding there, so she's got a little bruise. Hopefully she won't bruise much after this, but we try to be real careful with these injections because we don't like when people bruise. So you can see the injection's really superficial. You can actually see kind of the gray area, the gray part of the needle. And this actually, we call it hydrodissection. It actually helps separate the skin from the underlying muscle. We also put something in the solution called Y-dase, or hyaluronidase, and it allows us to inject, and it just diffuses, the local diffuses through the tissue really easily. Allows us to minimize the number of injections. Okay, so we're just about there. Okay, so we talked about, you can start to see that the skin in her upper eyelids is actually turning kind of whitish, it's blanching, and that's the vasoconstriction, or the constriction of the blood vessels that are occurring from the epinephrine. So we're going to allow this to work for about 10 minutes or so, and in the meantime, it may be a little bit longer only because we're waiting for channel 12 to come in here, but we're going to talk about upper blepharoplasty with them, and hopefully over the next few minutes we might take some questions that are coming in as well. But I'll finish the injection. Leslie's going to get her, well, actually we'll probably wait, but the next step will be for our nurse to go ahead and called prepping and draping. She'll be draped with sterile towels, and we'll get ready for her procedure.
Carolina. Bearcats 174-63. Today's game against Houston starts at 1. Well, up next, look good on your lunch hour. One of the most popular procedures after nearly 2 years of Zoom and wearing masks. We're going to actually take you into live surgery. It's next at noon.
Okay, seems like we're coming up next here,
Good
Gretchen.
on your lunch hour, sponsored by the Advanced Cosmetic Surgery and Laser Center.
Hey, Tommy. So we got to switch back to our screen swipe. So she's pinned. Yeah, that was it. Nope. Yeah, so we're recording that. Otherwise, we won't get it.
There we go. All right, Dr. Mendelsohn, can you hear me?
I can hear you. Can you hear me?
All right. Thank you for putting on the garb.
Yeah.
I would feel really bad if anyone thought you operated without it.
Right.
And we are taking into live surgery. So do we have a camera on her face, or are we just going to stay wide? Or, okay.
You've got, yeah. Tommy can hear you too, so he's, you let us know, but I figured you want to start.
Okay.
Yeah.
So I do. Is there something you can do, or are you just going to point out, or what's the best thing here?
Let's go to the close angle here, and I think what I was going to point out was some of this extra eyelid skin kind of thing, exactly what we're doing, exactly what we've done, and exactly what we will be doing.
Okay, and then I have some of your surgery video from a previous procedure, and then I also have the befores and afters you sent me. And then where are we pushing people? YouTube or Facebook? Or?
Yeah, I think YouTube. It's Advanced Cosmetic Surgery and Laser Center.
Okay.
And
all right, good.
Yeah, and I don't even know what's our YouTube. I mean, what's our Facebook?
Facebook is 351 Face.
351 Face is our.
Are you going? Wait, are you going?
Both.
Are you going to be on both?
Yes. So
Okay, I'll just tell people to search Advanced Cosmetic Surgery.
Okay.
Surgery and Laser Center.
Great.
Okay, 30 seconds. Stand
All
by.
right. Yep. One more time. Got about 15 seconds.
Stand by.
Look good on your lunch hour. Sponsored by the Advanced Cosmetic Surgery and Laser Center.
Well, after nearly 2 years of wearing masks, many people choosing to fix what's above the mask. One of the top procedures now requested, an eyelid lift. And we have a chance today to do something we've not done before, taking you to live surgery. Dr. Jon Mendelsohn of the Advanced Cosmetic Surgery and Laser Center joining us now. Okay, John, what's the procedure today?
Yeah, so this is exciting. It's called an upper blepharoplasty, upper eyelid surgery. And if you can see on Gretchen here, who just a few minutes ago, we marked the excessive eyelid skin, we call it hooding, that's causing her to look perhaps more tired than she wants to. So we've marked this tissue here that we plan to remove. She's all blanched because we've just localized her. We've numbed her up, and there's something in the local anesthesia called epinephrine, which causes the blood vessels to constrict so that we don't have bleeding during the procedure. So it's called an upper blepharoplasty, one of the best procedures anybody can have performed in their lifetime, I believe.
Okay, so a couple things. We have a little video because we got in a little bit earlier in the week where you were working on one of these. You mentioned there's a difference between when this is done for medical and cosmetic purposes. Can you talk me through that?
Yeah, sure. A lot of people will come in, and as we age, we tend to lose volume and elasticity, and some people have extensive hooding where it's actually obstructing their field of vision. And that would be a medical reason why you might undergo a blepharoplasty. A lot of what we do here is aesthetic or cosmetic, and that's for tired-looking eyelids. And so Gretchen looks great already. You can see her even here under surgery, but she does have some redundant skin here, and so we call this a cosmetic blepharoplasty so that she will feel and look more refreshed.
Okay, so going back to Gretchen, I wondered how long does this take, because I know you are doing something that we've not done before. You're going to continue this procedure because we didn't want to show, sort of the cutting and whatnot live on the news. So tell us a little bit about how long it takes and how long we'll be watching for
Yeah,
that.
this is exciting. So we're going to be streaming to Facebook and YouTube after we leave you here, and we're ready to go. So each eyelid actually probably takes only 10 to 15 minutes. We're going to remove this redundant skin. There's a little fatty tissue sometimes that will contour or modify. And then there's one stitch we use. We place it back and forth underneath the skin. She'll have a little knot on either side here that will stay in for about a week. She probably will not even require Tylenol tonight. Obviously, she'll have a little swelling, hopefully not much bruising. And the results from this last 20 plus years, it's a great, great procedure.
All right, let's show people some of those results. But we pushed you to Facebook and YouTube. You sent us some befores and afters of a previous patient that had this done. Pretty remarkable, as you say, looking a lot less tired. I know a lot of us, after seeing those eyes on Zoom and above the masks, are turning to this procedure. Costs you about $5,000 in the cosmetic things. It's not covered by your medical insurance plan. But if you would like to find out more about this procedure, 513-351-3223. Go to what'shappeninginhealth.com, click on the Advanced Cosmetic Surgery and Laser Center, and you can hook up and watch this live as soon as the news finishes, of course, at 12.
Right.
John, we thank you so much for joining us today. Great to see you.
Thank you, Liz. Appreciate it. Have a good day. Okay. Thank you. Okay, so I think that we are back live on YouTube and Facebook. Okay, we're going to continue with our upper blepharoplasty. Gretchen looks so excited. Look at that smile.
I'm going to cover this eyes. Go ahead and close your eye for me.
I think that's why you're happy, right? Okay, so presuming everything is good here, we've marked her, we've localized her, and we're going to start the surgery. Gretchen, you may feel my hands on you. I might move your head back and forth a little bit. The table might move. Just kind of go with it. So we typically, I use a 15 blade. It's a scalpel to make this incision. Others may use laser or cautery. There are different devices that can be used. But but I don't think there's a significant difference. This is just the way we do it. So, all right, and so what we're going to do here is we are just going to simply remove this skin. Now, some people will remove the skin and the muscle beneath it, which you'll see in a minute. I think it's a little bit safer and smarter simply just to remove the skin. The orbicularis is the muscle. There are no studies that have shown that there are problems removing that muscle, but technique-wise, really what we want to do is get this redundant excessive skin removed. Okay. So, Gretchen, you're going to hear a little sound. It sounds like a bug zapper here, a little cautery. Tiffany, do me a favor. Would you mind turning that fan on? I know we decided to keep it off, but...
I'm okay with it.
You're okay?
I like this one.
I don't know if Leslie's okay with it. Thank you. So sometimes right along this, I guess, this eyelid incision here, to accentuate the crease, sometimes we'll cauterize right in this area. We'll stop this little bit of bleeding first. Okay, so we'll take a look at the anatomy here. And what we're seeing here is, you know, the orbicularis muscle. And like I said, we're going to leave most of that intact, but medially here, we're going to see if she's got any fatty tissue. And there's a nasal fat pocket, two different fat pockets, and a central fat pocket. And so you can see that come right through, right there. So this is actually called the pre-aponeurotic fat. We're going to remove some of it. We don't want to be too aggressive removing this fat. You know, years ago, what we used to do is remove with the upper and the lower eyelids as much fat as we could. And that was just kind of the way things were done. But a youthful eyelid actually has some fullness in it and some volume. So we've been more conservative with that. There's another fat pocket in here. Let's see if we can at least identify it. I'm gonna localize this. I'm gonna numb it up a little bit, more for bleeding than anything. So, actually, and Leslie, when I take this off, let's just save it for a minute because I want to see if I find the other fat pocket. You feel that, Gretchen?
No.
All right, so let's see here. We're just gonna shrink this down a little bit here. Do me a favor, thank you. Okay. We'll stand by there. I'll give us a moment here. We have a little technical camera problem, actually. Sorry, Gretchen. surgery's going well. I think we lost our connection, that's all. Yeah, we should be back here. Never tied this, that was the problem. Okay, think we're good. Think we're good, Tommy. All right, so we had a little technical problem, not with the surgery, but with this camera. So we're back. We're back at it. Tiffany, do me a favor. Can you pull my glasses off for a second?
Yes.
Thank you. Little pressure here. Yeah, thank you. All right, so we're hunting around here for. There's another fat pocket. She doesn't have much fat anyway, but I wanted to show you the difference between the central or the nasal fat pocket, which is whiter. It's richer in stem cells, actually. This is the one that actually gets worse usually with age. The one that we remove some of actually disappears, atrophies a little bit with age. So, don't have the direct contrast here, but we're going to shrink this a little too. 1, 2, 3, a little stick. Okay. Okay, great, thank you. Suture, yep. So the next thing we're going to do here is close it up and head to the other side. So there are a lot of ways to close this as well. This is called a running subcuticular suture. So this is a permanent suture that we need to remove next week. So this goes actually underneath the skin and then back and forth. So we don't want to bunch up the skin in the medial canthal area. Sometimes this is where you actually see a little bit of bleeding. So you go through the surgery, there's not a lot of bleeding. And then you go to put these sutures in. And this is where you could get some bruising, so hopefully we won't see that. So you can see a little bit of bleeding there. It's just from the skin edge. As soon as we're through, we're going to put some ice on it. Doing okay, Gretchen?
I feel that.
You felt that?
Yes.
That was Leslie's fault. Sorry. All right, I'm going to put a little more local in here, a little injection. Sorry about that. Yep. Obviously, you're feeling that. Okay. So generally speaking, the skin edges come together pretty well as they are for her, but we might put a few interrupted sutures in too. So you can see it kind of zips it right up. And we're going to tie a little knot. Yeah. We'll take some more local in a sec here. We might. So you can see there's a little bit of a gap here. There's more tension here laterally, so we're going to put a couple of interrupted sutures here also. Maybe 2 or 3. And maybe one more here. Okay, well that concludes our surgery for today.
Should I get them?
Oh. Oh, that's not funny. Okay, we're going to ice you down here. Good job. Sorry about that little stick there. And we're going to head to the other side. And I'm going to number up a little bit more.
Nice compress there for you.
You feeling that too? Oh, geez, you're maybe metabolizing this a little bit. Sorry.
Here comes a cold one, Gretchen.
Actually, I guess it's been a little while, huh, since we injected. Okay, so we're going to match things up over here. At least we'll try. All right. Excellent. All right, so that's our incision. Same thing. I remove the skin only, not the muscle. Do you take any vitamin E or anything?
Multivitamins, but I stopped. I'm bleeding.
You stopped yesterday?
No, 2 weeks ago.
You have nice healthy blood, nice bright red. All right. So, not that it really matters. There's probably a little more bleeding than we see, probably because we injected it so early. So I'm cauterizing on the edges now only because we know when we close it sometimes we can cause a little bit of bleeding like you saw on the other side, so just getting ready and cauterizing the edges. Same thing here, we're going to remove a little bit of this bicularis muscle. You can already starting to see, Gretchen, I'm going to kind of pull things up. All right, this is a little bit better. You can kind of see this is a little wider than what we saw before, and this is that nasal fat pocket. Local. I feel a little burning here. So, like I said, we used to be really aggressive with this fat removal. And I'm not really sure. There's something called the A-frame deformity where you'll see people kind of lose some volume here. And, you know, over the past 20 years or so, things have changed in terms of how to approach aging eyelids. Sometimes there are procedures where the brow is ptotic or drooping and we need to do other things to elevate the brow. Or sometimes you have a droopy eyelid and there are other procedures. Did you feel that? Huh?
Oh,
Did you?
up in my head.
Up here?
Yeah.
Oh, sorry. I'm going to inject this anyway because I couldn't tell. Okay, suture. Gretchen, you doing okay? Mm-hmm. Okay. So same thing here, these sutures are underneath the skin. Just answer some common questions with this procedure. Things like, I know some questions came in about how long does this procedure take? Well, you see how long it takes. It takes longer to kind of get things marked and measured and localized. Procedure itself is pretty straightforward. Patients usually don't experience much pain or discomfort. A little bit of a burning sensation as the local wears off, so she might be experiencing that already on the left side, but usually doesn't require anything more than Tylenol, sometimes nothing. Next week the sutures will come out about 6 to 8 days later. We just cut the knot on one end and slide it through. Very easy. A lot of people are worried about suture removal. She'll have some swelling. I mean, we'll try to track this a little bit, hopefully, so you can kind of see how she's doing with glasses or sunglasses. I mean, she's going to feel well, and you know, it's hard to hide your eyes unless you are wearing glasses or sunglasses, but she'll have a little swelling that will drift down around her cheeks, but the recovery is pretty quick otherwise, and the results are pretty long lasting. We tell people easily 15 to 20 years. But it makes just a huge difference. There's a lot of there are a lot of studies looking at the movement of our eyes and how we communicate, like the saccadic movements of our eyes, how we look at each other back and forth. And this is just one of those procedures that really helps people look more refreshed, not startled, not awake, not like Kenny Rogers, who had an over-resected, over-aggressive upper blepharoplasty, and he had a brow lift. So all this stuff went up, and he really sculpted his upper eyelids. This should look natural. Most people who don't know that you've done something will compliment or comment on your skin or your hair or something you're wearing, or just looking refreshed. And that's really the goal with these procedures. Over the past 2 years, I think we've seen more and more people who are, you know, staring at themselves on Zoom meetings, and I don't know, whatever people are doing, but they don't necessarily like looking tired. And this is a very straightforward procedure that does a lot of good. All right, yeah, one more immediately there. Gretchen, you hanging in there?
Yes, doing great.
We're just about through. So we'll be, for educational purposes, we'll be following Gretchen a little bit so you can kind of see what the recovery's like, how she's doing. She shouldn't have much bruising, but like I said, there's a little bit of bruising. But already you can get a sense for what's going on. Clearly she's got a lot of swelling here, but her eyelids should look fantastic. So that is an upper blepharoplasty. I think, like I said, we're going to follow Gretchen through this whole series. Thank you. Sorry about that little stick earlier. You know, just stay tuned to our Facebook, YouTube, and we'll follow her progress and share more about eyelid surgery with you. Thanks, Gretchen.
Thank you.
All right. Thanks, Leslie. You right there? Okay, yeah, I think we're good. We're great. She's got a smile back on her face. Come on. Those pearly whites.
Thank you.
I think we did pretty well. Hope we got it right. Yes.
I'm gonna wait till we're done.
Oh. Uh-oh. Not sure where our, I guess I moved it, our little hamper. You want to stay there for the day? Let's say we get you to a comfy chair. You okay? Valium got you? Well, let's get you iced nicely here. What's wrong?
Are we off?
I don't know. I don't think so.
No.